Hello everybody and welcome back. Hey, this time we're talking about heart sounds. I'm Cliff Davis. I'm the Associate Dean of Nursing and longtime advanced medical surgical professor, okay? Let's jump right in. Okay, so what are we doing at RN Cliff Notes? Helping students to see through larger concepts. All right, so you know the drill. So number your paper or your device from 1 to 5, okay? So we want to bring some concepts forward, right? All right, so now, that's it, it didn't go away. Okay, now, this time, here's what we're doing. So we want you to come up with the code, utilizing the numbers. And remember last time you were a red blood cell and you started in the foot. This time you're a red blood cell and you're starting in the lungs. And you're coming back from lung circulation and headed into the heart. And on your way into the patient's head, let's say, right? On your way to cephalic region, we're going to say that you're coming from the right lung, okay? So what structures would you touch if you were a red blood cell, right? Traveling back from the lungs and you're going into the heart and you're going to wind up in the cephalic region, okay? And pause the video if you need to. And the code that you should come up with, if we're coming from the right lung, right, should be 3, 13, 14, 16, 15, 10, and 9. Okay, let's check our work though, right? So we want to be straight on our circulation in the heart. So here we go. All right, so looking back at that picture, we said we were coming from the right lung, right? So our patient's right lung will be over there on the right side. So we're starting at what? 3 over here. And as we come across, 3 is going to enter, right, back into the heart at 13. Okay, so 13, we've come out of our pulmonary veins, remember, right? Is that because the circulation is switched when we talk about pulmonary circulation? We're coming back from the lungs. Then we're dealing with oxygenated blood. And this time it would be pulmonary veins, the switch. So 3 pulmonary veins. Then that's going to empty into 13, right? Our left atrium. And then out of the left atrium, we're going to hit structure 14, which is that valve right there. And we said that is the bicuspid. What's the other name for it? The mitral. Yes, you're on top of your game. Okay, then 14, as a red blood cell, is going to touch 16 next after that. And after 16, it's going to go into 15, headed into the aorta. So it's going into the aortic valve, right? So now, up through 15, into the aortic arch, which is 10. So from 15 to 10, and then finally at 9, right? With our brachiocephalic and things like that, coming off of our aortic arch. So your numbers should have been 3, 13, 14, 16, 15, 10, and 9. All right, good job. Okie dokie. So here we go. More questions. So that was number 1. Here's number 2. With this heart sound, dub is heard. So your choices are S1, S2, S3, S4. With this heart sound, dub is heard. Okay? Next, number 3. With this heart sound, we hear Kentucky. Kentucky is heard. Which one? Right? Which one sounds like Kentucky? All right, now, for number 4. With this heart sound, love is heard. So which heart sound is love heard? Okay, and 5 is, with this heart sound, Tennessee is heard. We hear a sound that sounds like Tennessee. Okay, all right. So now, just a quick review for some of you, and you know, a lot of insight coming up here in a minute. S1 is the sound where we hear love, and that's closure of the atrioventricular valves. Well, let's be pretty specific about that. So atrioventricular, so between the atria and the ventricles, that valve there, that's where that's located. So atrial or AV valves. Both of those valves are closing, tricuspid and bicuspid. Okay? Now, S2, where you hear the dub sound, that's closure of both of the semilunar valves. Okay, but hold on. As we talk about those semilunar valves, and we get it, their names are, you know, aortic and pulmonic. But what's that all about, right? Because we throw those terms around a lot. Semilunar, semilunar. Okay, so what does it mean, right? So semi is like halfway, partial. And lunate, luna inside of there means moon, a partial moon. It's referring to the crescent shape of the structure as the blood's flowing through there, the crescent shape. So semilunar valves, right? Good. And that's your aortic and pulmonic. Just a little tidbit here, and there's probably extra information. If you keep these valves in alphabetical order, you'll understand which valve closes first. So aortic would close before pulmonic, even though they sound like they're happening at relatively the same time. Aortic before pulmonic. The same thing is true for the previous slide, where you'd have mitral just before, right, the tricuspid, although they're sounding like one sound. Okay? All right, good. So we got our S1 and S2. So our typical normal sounds in terms of heart sounds, right? But now, let's elevate our knowledge, because we're good with love dub. All right, S3 is what we want to get into. So this one is referred to as ventricular overload. Also, you're going to hear a lot of talk about gallop, right? So ventricular overload, or it sounds like a ventricular gallop. So now, that's normal in children. Pregnancy and CHF over there. To auscultate it, you want to put your belly or stethoscope at the apex of the heart, or the lower right ventricular area with the patient in the left lateral position. So it's pretty consistent that you're putting the bell of your stethoscope at the apex of the heart and this left lateral position. And we'll see that again in the next slide. But I want you to flow with me for a minute, okay? Because you're watching the Cliff Notes channel, right? Or in Cliff Notes. So we came to get what? Higher knowledge, right? So here it is. As we're looking at S3, right, and eventually we're going to be talking about S4, I want you to pay attention to what I highlighted in red. I highlighted the words what? Children, right? And where do children come from? They come from pregnancy. There's a very interesting thing about S3, that 3 is what? A lower number than S4. And it tends to be normal in those patients who are what? At a lower age level. We're going to see the opposite in S4. See, S3, lower age. S3 is a lower number than S4. And it's normal in what? Children. And interestingly, what? Pregnancy, right? Where a woman's about to give birth to what? A child. Okay? Now, when we get to S4, you're going to see the mention of what? That's a higher number. S4 is higher than S3. So we're dealing with what? An older population. Okay? So let's check that out. S4. This time, what? Atrial gallop. Normal sound in trained athletes. And what? Older patients. Again, right? S4. Older in age. Okay? Old enough to be an athlete. How about that? Okay? Yeah. Now, so we're auscultating again at the apex of the lower right ventricular area with the patient what? In left lateral. However, this one does have an added position. You could do left lateral, or you could have the patient in supine position. Either one of those will work, right? But consistently, whether you're talking about S3 or S4, you can have the bell of your stethoscope at the apex of the heart and the patient in left lateral. Okay? All right, now, I also want to explain this one. It's like an added bonus. So we talk about S3, we talk about S4, but there's another one that's called a summation gallop, right? And summation. If we were talking about summation in terms of mathematics, we would do what? Add up the sums of things. We'd add up the numbers, right? In this case, that's exactly what we're doing. We're adding S3 and S4. All right, let's check that out. So, summation gallop. When you hear all four heart sounds, where S3 and S4 come together and almost sound like a prolonged sound. What? There's sum. The sums are brought together. So you hear S1, you hear S2, and S3 and S4 sound like they're kind of meshing together, making a prolonged sound. So a summation gallop is another heart sound, right? Those heart sounds together. Okie dokie. Now, let's break this down, right? Again, RN Cliff Note style, here we go. You can decipher the heart sounds of S3 and S4 using the vowels. Okay, so we got to keep our minds open, right? So here we go, here we go. Vowels. Typically, when we're talking about our vowels, we know our A, E, I, O, U, and sometimes Y. When we're talking about this, it'll be all the time Y. Okay, yeah, right? So we're paying attention to the vowels. So here we go. What do I mean? All right, it's coming up shortly. So with the heart sound for number 2, just to check your work real quick. When dub is heard, you should have selected B, S2. Dub is the second sound heard. So we're used to hearing love, dub, dub. Dub is the second sound, S2. All right, again, checking your work. Number 3, with this heart sound, Kentucky is heard. Okay, so we've got S3, Kentucky is the third sound. But hold on, we just made mention of A, E, I, O, U, and Y, right? And we said that the vowels help us to decipher which heart sound we're dealing with. So, when it comes to S3 and S4, we look at our vowels, what do we see? We've got E, we've got U, and we've got Y. We've got what? 1, 2, 3 vowels in there. So which sound is it? S3. Okay? Yes, good. Now, moving on to number 4. You should have selected A. With this heart sound, love is heard. So we know love is the first one, S1. All right, moving on. All right, now, with this heart sound, Tennessee is heard. And you should have selected D for S4. And using our vowels to decipher it, right? We got what? E 4 times. 1, 2, 3, 4. So this is what? S4 is where you hear Tennessee. And be careful. Sometimes you'll be online and things like that, and you'll hear all kinds of different things. And I've seen some sites where they're mixing these state names up. They're calling, they're saying S3 is Tennessee. That's not right. You know what I mean? It just isn't. Okay? And where I'm pulling this data from is a textbook called, actually, let me grab it. Textbook we use in our nursing program, Health Assessment in Nursing, right? By Janet Weber and Jane Kelly, right? That breaks this down specifically. Now they don't talk about the vowel thing. That's my own little thing. Okay, all right. So yeah, so 4 vowels. There we go. So S3 Kentucky, S4 Tennessee. Right now, number your paper or device from 6 to 9. 9's kind of a weird number to stop at. I have to come up with some kind of 10. Okay, so let's see what we're gonna do. All right now. So 6, Actually, I put 6 on this thing. But this is going to be actually 6 and 7. We're going to break that down to 6 and 7, okay? So what is the formula for cardiac output? We came here to get smarter, right? This is our Cliff Notes. You know what I mean? We gotta grow new wrinkles in our brain. Yeah. And so, all right, if you don't know this, so formula for calculating cardiac output, or CO. And, right? And also, we want to add to our papers. So we did 6 and 7 just a minute ago. Here comes 8. So which sound is ventricular gallop? All right, so back to deciphering our sounds. Which one is referred to as ventricular gallop? I'm going to show you an easy way to remember this, right? All right, so pick one of those. And now, that brings us to number 9. Which one represents atrial gallop? Remember earlier I said you'd be hearing, gallop, over and over again. So one of these represents atrial gallop. Okay, so here we go. All right, so back to 6 and 7. To calculate the cardiac output, you need to take the stroke volume and multiply by the heart rate. Stroke volume times the heart rate equals the cardiac output. Now, heart rate was solid, but for some people, stroke volume might sound a little new. So, stroke volume are the SV. The volume of blood being pumped by the heart, in particular by the left or right ventricle. So, here's the way to think about it. How much blood is being pumped out of my heart, right? How much blood is being pumped out of my heart? That's the stroke volume. But then now, we want to multiply that by the heart rate. And that gives us the total cardiac output for that patient, right? For 1 minute. So the heart rate, we know how fast it's actually beating. But the other thing we need to know is like, how much is it pushing out with each one of those beats, right? Yeah, and in 1 minute, we can capture that person's, right, cardiac output. Yes, okay. So now, here's how we figure out 8. Now, the reason I put that stroke volume in there, right? Let's back up a little bit. The reason I put stroke volume in there is because I wanted to engage in a little bit of wordplay and elevate your knowledge here. Strokes, right? And then we've got stroke happening what? That word before the V there. And what we want to do is look at how many strokes does it take to make that letter V? Because that's important, okay? That's going to actually help us figure out which heart sound goes with it, right? Because all we need to do is look at the number of strokes that it took to make that letter, right? For what? Ventricular gallop. Then we want to look at how many strokes it takes to come up with the letter A for atrial gallop. And in each case, all we're going to do is add one number to each one. Okay, so here we go. And, all right, so which sound is ventricular gallop, right? So we're adding a stroke to whatever we come up with, right? So we've got what? 1, 2 strokes to make a letter V. Plus 1 would be what? 3. S3 is where ventricular gallop is heard. Okay, on to the next one. With the A, right, to make a letter A, and it will go plus 1, yes? So 1, 2, 3 strokes to make a letter A plus 1. S4 is where atrial gallop belongs. All right? Good, good. All right then. So wait a minute. We're at the end. But we wanted to come up with a great number 10. Having to do with cardiac. On the spot, I tell you. I put myself on the spot. All right? So, how about this? Since we're talking about the heart, and One of the things we want to get into in a later video is that some people can tend to go into shock. And when that person goes into shock, first, we want to know what's the name of the type of shock where the person's heart is compromised. And you say, what? That would be cardiogenic. Good. Now, to wrap this up, let's give ourselves a bonus, okay? What are the phases of shock? Okay? And what do you say? The phases of shock are, if you don't know, good thing you're here. They're super easy to remember. Now, if somebody's heart is compromised, right, they're having a heart attack, their heart stops, what are we going to do to that person? We're going to do what? We're going to perform CPR, right? And those are the stages of shock. Compensatory, C, progressive, P, and refractory, R. Study smart, guys. Thanks for tuning in. Thank you for liking and subscribing.